Namaste and good afternoon. Welcome to a very special Facebook Live session today. This is Dr. Srinidhi Chidambaram. The way the world lives with COVID-19 has now changed a lot. We have come to a stage where we have learned, or we don't have a choice but to live with the virus. But the danger of a new variant of COVID-19 or a cluster of infections suddenly surging up is always present. So one extremely critical tool in curbing the spread of infections, curbing the severity of infection, all those devastating waves, has certainly been the COVID-19 vaccination. By now, I'm very sure that you've all had your 2 doses of your COVID vaccine, and maybe many of you also the precautionary dose. If not, please do so immediately. But one group that has so far not been addressed or has just, the group that we are now focusing on and hitherto not really looked at is children. So you're aware that India has been rolling out COVID-19 vaccines in a phased manner. So in the first phase, it was really the prioritized groups, which were the healthcare workers, frontline workers, the elderly, the vulnerable, and then it expanded to include most adults. And then in this year, that is in January, the 15 to 18 age group, 12 to 14 age group were all authorized for the vaccine. Many vaccines for this age group for children and teenagers have been given emergency authorization. So we keep reading all that in the newspapers. There's been Covaxin, zycov-d, Covovax. And also recently we have understood that the DCGI has given emergency use authorization not only for the older age group, but even for children between 6 to 12 for Covaxin and Covax for children between 5 to 12. So considering that children and teenagers are now the vulnerable and unvaccinated group compared to other age groups, and also since schools have opened up and we really cannot afford to have those indefinite closures like in the past, this is a very welcome move. But for parents across the country, there are, I'm sure, many questions in their minds. What vaccine, when to give, and there are so many different news items appearing. So what would be the side effects? Is it necessary? Is it safe? So many questions. Will it be mandatory? So today we are going to talk to Dr. Sharmila Pendyala, who is going to give us the answers to all these questions. So Dr. Sharmila is a very well-known pediatrician who has been working at Apollo Hospitals and Apollo Cradle, Jubilee Hills, Hyderabad, and she has over 17 years of experience in this field. And she has done her MBBS and MD in pediatrics from the Osmania Medical College, Hyderabad, and also has special interest in adolescent medicine and developmental pediatrics. Dr. Sharmila has received many awards throughout her career, like the Vaidya Ratna Award from the Indian Solidarity Council, New Delhi, Medical Excellence Award in Pediatrics, National Mahila Ratna Gold Medal Award, and many more. She also has held many academic positions both here and abroad, like the Honorary Associate at University of Sydney School of Medicine, Australia, and also is a tutor for fellowship in pediatrics at Medvarsity, Apollo Hospitals, Bangalore. And she's also a member of the Indian Academy of Pediatrics and has also won the APJ Abdul Kalam Award for Excellence in Healthcare and is a top and well-known panelist in top Telugu channels and YouTube as well. So welcome Dr. Sharmila to this Facebook Live session. I'm sure parents all over are waiting eagerly to hear on what they should do about vaccinating their children and teenagers against COVID-19. Over to you.
Yeah, thank you for that kind introduction, Srinidhi, Dr. Srinidhi. And even I'm looking forward to share that piece of information because I'm as kicked and excited as any of the parents, primarily because I'm a parent myself, and more importantly, all the patients who come to me, their parents, they're very anxious to send the children to school. I've been actually actively campaigning return to school for the past couple of months, and for obvious reasons, but the most important one being I have seen firsthand lot of learning disability, lot of psychological disorders and screen addiction that has crept into every home, including mine. So I'm more than happy for the schools to reopen, and I am more than happy for all the parents out there for the DCGI approval. It's right now we have been blessed with two vaccines that have been approved, for one for 5 to 12-year-olds, the other one for 6 to 12-year-olds, almost the same age group, and a third vaccine which has been approved for 12-year plus. The three vaccines, I think these are the major ones, major players in COVID vaccination in kids. I'll tell you some statistics which are like astounding. So when the often asked question is, how safe is a COVID vaccine? Do we need to take a COVID vaccine for kids, doctor? Because you yourself on various platforms have said that 95% of COVID in children is not problematic at all. It's just like
I was
any
just
other
going to ask you,
upper
in fact.
respiratory infection. So I have an answer for this because I knew this is the first question anyone will ask me. So coming back to vaccines in general, what are all the aspects that we need to worry about or we need to know about when we are going in for a vaccine, not just COVID vaccine, for anything for that matter? So right now, more specifically for COVID, it is, why are we so much after vaccination? It is because it is a pandemic which has had a lot of psychological, economic burden to the world at large and to each individual. Every single person on this planet has been affected by COVID directly, by the virus, or by the impact it has created.
Absolutely.
And so very simply put, how do we get out of this situation? The only way right now to contain the pandemic further, I would say, we are not at a very bad crossroad at the moment, but then we never know how the future will unfold. We do not want to take any chances, and it's imminent. It's almost an emergency for us to do everything that can contain the pandemic. So vaccine plays an important role. So why do you have to take it when it is of very negligible effect in children? It is because children can carry the virus, children can transmit the virus, children also have equal viral loads, and last but not the least, those few children who can be affected, definitely I want, for me, every single life, every single child is important, not just as a pediatrician, even if I think as a parent, I obviously don't want to take any kind of chance with my child's health. And what is the way out? In spite of seropositivity being high in children because of asymptomatic infection, please mark all my words. It is not completely, you're not immune just because you have an infection. It is not that virus which can give you lifelong immunity just because you had one. In fact, I personally have treated 1,000 plus more kids with COVID, and I have seen recurrent COVID in lots of children. So we do not know what long COVID can do, particularly for children, now that the entire data for long COVID is not still on the table. The second thing is, I have treated, I will say, albeit very low numbers compared to the number of people affected, but I have treated multi-system inflammatory syndromes, one or two of which were, I mean, the child landed up in the emergency in nearly irretrievable state. Thanks to the emergency, I mean, we could help that particular child, one or two children who have come, but then definitely there were lives lost, even in children. So with all this around, when you're sure that the vaccine is not going to cause serious side effects. Why not go for it? You in fact have to go for it. So coming back to the question again that pops up in any parent's mind. So is it safe, doctor? How safe is it? So for that, I'll tell you, if you know the vaccine platforms that are approved for children, how they're made and why they are safe beyond any doubt, then you will know why you should take it. So the major platforms approved for children at the moment are, it's a killed vaccine, which is Covaxin, killed viral vaccine, what we call whole cell killed viral vaccine. And when it comes to Corbevax and zycov-d, Corbevax is something very analogous to hepatitis B vaccine, which is a protein subunit vaccine. And while you shift to zycov-d, it's a plasmid, genetically engineered plasmid derived vaccine. So all the three vaccines, you leave the efficacy for a while. I'll come back to that. Safety wise, they are extremely safe, extremely safe. And to just comfort all the viewers out there, we have so much follow-up data for the adults who took Covaxin also. So we have kind of data that the adults never had when we started immunizing. The children now have so much data from the adult counterparts. Yes, all the phases of trials that are required for emergency use authorization have been completed. And we also have large data, phase 4, what we call when we give to large numbers, phase 4 data from the adults also. So there are no serious side effects, the usual ones that we have seen for adults with the other platforms, say like Bell's palsy or pericardial inflammation or thromboembolic. None of these are there for all the three vaccine platforms that have been approved. And this is the reason why it is very, very safe, number one. The second one is how efficient is this? Okay, I will go and take. Why should I get that little fever, little pain, or little some nagging small things, even with vaccine, a little muscle pain or a fever or a local pain? That's what are the things that we can anticipate for these three vaccines. So it is because it is highly efficacious. It's in fact uh, as efficient as 93 to 97% in a couple of vaccine platforms, the Corbevax and all those. And every vaccine which is efficient, whose efficiency is upward from 60%, is supposed to be highly efficacious and highly effective vaccine. It is more effective than the flu vaccine, which in itself is highly efficacious. So when I draw analogs, Covaxin is like the kill attenuated flu vaccine. Corbevax is like the hepatitis B vaccine, and zycov-d is the plasmid derived genetically engineered vaccine. And one more very heartening thing to know is, because we have done this to stop the pandemic, all the scientific community and all the funds have been diverted into getting vaccines at the earliest. We actually have hope for the large number of diseases that we never had vaccines, which were troubling us, like HIV, malaria, dengue, because we can just replicate what we did for COVID for all those couple of platforms, we can replicate it. So in more than one way, I'm very excited about these vaccines being approved for children.
So, doctor, if there is, so now that we have a different varieties of vaccines, is it going to be like, something that the parents can choose, or if at all they choose, what should they choose, or is it very age specific?
Yeah, that's a very dicey question for me to answer. At the moment, I don't think. See, the DCG approval doesn't mean that we are already underway immunizing. We need two more bodies to actually decide the price, decide how to monitor the adverse effects, to take the feedbacks, and is it going to be given only on the government, in government setups, or Will the private also be included, just like it was included for the other age groups? All these questions are yet to unfold. So choosing the vaccine, we might have a choice. Maybe not in the extreme near future, but then yes, eventually we are going to have a choice of vaccines. Definitely. And which one to choose? Data is still not sufficient. Like all of them are good enough. I think rather than thinking about choosing a vaccine, you just have to be more ready to take whatever is available in your local area, whichever is being distributed for that local area, because they will have a way to distribute vaccines so that there is no shortage. Because you'll be surprised to know that less than 25-year-olds, the very young population is almost up to ranging between 25 to 40% in various parts of the country. 40%, 25 to 40% of the population are the ones who can be called the young, very young population. It's our advantage because we have a young force coming up, and it's also the reason why there will be a huge demand for vaccines. So they will chart out. It is yet to chart out, government, as to how to distribute which vaccine to whom and all those logistics.
So the key message here is that, whatever it is, all of them are equally safe, equally efficacious, and you can go ahead and follow and take what is available in your area when it is launched. So what about other vaccines? So, in this age group, there will be other immunization schedules also.
So will it interfere with taking the rest of the vaccines? This is also a question one of my questions asked. Can we take, just like, we actually give more than one vaccine at each go. So is it safe to take COVID and something else also, is one of the questions that one of my patients asked. Yes, it is at the moment, because when you consider the vaccine platforms, it's about, usually the choice of vaccines depends on whether the both of them are live attenuated, or one is killed and both of them are killed, or both of them are subunit vaccines. The ones that are approved right now, kill vaccines and subunit vaccines, protein subunit or the plasmid ones, they usually can be taken along with other vaccines. But then children have such a big choice of vaccines. Because most of the immunizations happens in childhood. On a case-to-case basis, you better discuss it with your pediatrician. As of now, you can take it along with all the usual set of vaccines. Yeah, you don't need to stop. And there was one more question that someone asked, can I continue? In fact, we had this scenario also. There was a dog bite, and they were due for the COVID vaccine. They were also due for the rabies vaccine. So they were asking me whether they have to stop either one of them. I said, no, you can go ahead with both the vaccines.
What about the side effects?
What the data as of now says. Yeah. Pardon?
So, you say?
As of now, the data is this.
Yes. Okay. So now, what about the side effects? Though they are minor or major, so what are the common side effects in children?
See, the reported side effects during when the data about these vaccines have been tabled, they're very minor. The local pain, pain at the site of injection. So in some children, they can have a little bit of fever, malaise, which is like feeling unwell kind of thing. Maybe very minor headaches, body aches. Other than this, there are no life-threatening complications that have been encountered. None. But then I insist that every single vaccine has to be taken in a hospital setup.
Yes.
Where there is always, because if you're allergic, that will get into one more topic that they ask me is, what are the contraindications? If you're known,
yes,
if you're allergic to these components of the vaccine that the vaccine is made up of, if you've had a previous history of allergic reaction, that's not an absolute contraindication, but then you will have to tell your doctor who is administering it, so that they can have the resuscitative equipment by their side. There is no absolute contraindication for the vaccines that are actually enumerated for kids. because none of them are live attenuated. But if your child is running a very high temperature on that particular day, then don't go and take it because it's not an emergency thing. You can postpone even the boosters by a week, 2 weeks also. It doesn't interfere with the development of immunity. If you're unwell, don't go for the vaccine. Just postpone it by a couple of days. That's all.
And are there any children who should not be taking this vaccine at all, as in children with compromised immunity? Or is there any data on that?
As of now, none absolutely. But as I said, it has to be in a hospital setup because sometimes you might react to the other either the adjuvant or the preservative, any medicine for that matter. The first time you take something, there is always this risk of throwing up an allergic reaction. So it's there's no absolute contraindication for the killed vaccines. But while you are in the period of COVID, you are right now suffering with COVID, that is obviously an absolute contraindication. You will have to recover from it. You have to recover from it, take the 2 week gap, and then only take the 2 week gap and then only go on and take the vaccine. So apart from that, I don't think we have any absolute contraindications like the transplanted kids, then kids on chemotherapy, diabetic kids, asthmatic kids, kids who have undergone heart surgeries, lung surgeries. All these kids definitely are the ones who need it more than anyone else. So you don't have to hesitate to take any of the vaccines, but then discuss the primary condition. Even immunodeficient kids also, normally the contraindication for all these high risk group is the live
Yes.
vaccines, wherein the live virus which is attenuated can still, I mean, become more virulent once it gets into an immunocompromised host. So for HIV kids, for primary immunodeficient kids and all these, live viral vaccines are not approved. But then all the 3 vaccines right now that are approved have no live virus.
Another common question, which I think is being asked many times, is will children who are vaccinated still get COVID? And also, if they've been vaccinated, can they still transmit the infection to
Yeah,
others?
very beautiful question. Very beautiful question. I'm happy you asked this because I mean, I've said this many a time, but I would like to make it even more clear. Vaccines, none of the vaccines will prevent infection. All these vaccines are given to prevent serious disease, hospitalization, and complicated COVID. There's a difference between infection and disease. Infection is the entry into the body. Disease is to cause all the effects of the disease that that virus is supposed to be causing. So, but then are there no vaccines which can prevent the entry? There will be in future, and those are the drops, nasal drops vaccine, the live vaccines, which will be given in the mucosal. That is where the virus actually gets
Statues.
into the body, the route of entry. That is where they're going to block. I'll tell you an example for this. It's like the oral polio drops. Oral polio drops will give you mucosal immunity. Your gut also will not allow the virus to get in. Whereas injectable polio vaccine will allow the entry but then kill it once it enters the body. It's something like that. They are the classic example for the live attenuated versus the killed vaccines. But then live vaccines, though they prevent the mucosal entry, they can't be given to everyone. Like I said, the immunocompromised host can't take the live attenuated. So we are very happy to have the killed vaccines because they are going to provide us the most important immunity against serious disease, against complications and disseminated disease. So that we are worried more about that. But then a word of caution is that because you have the ability to infect in spite of taking the vaccine, you also have the ability to infect others. You can get the virus, you can carry it in your upper respiratory tract, and you can transmit it. So the other important things like masking and distancing and hand washing will always be important to curtail the transmission. Yes, definitely the viral loads are also known to be lower in those people who are immunized, vaccinated, and more so with hybrid immunity, someone who has suffered and taken vaccine. This is the group which has the maximal immunity. Yeah.
So are there any further things that you want to tell our viewers, and also are there any further precautions or anything that people should know
Yeah,
using?
the other thing that probably I wanted to say, just to reiterate what I said, is, see, why do you have to still take? I got it twice. Someone asked me this question. I got it twice. I have my antibody levels. Antibody levels are not the ultimate thing. Your T cells need to be sensitized, and that happens with the vaccines more than with mild natural infection also. Please. So getting an infection will not preempt you from taking a vaccine. You need to have hybrid immunity. The best immunity to have is a mild infection plus vaccine. I'm not encouraging anyone to have an infection, but these are what the medical data says. People who have had a mild asymptomatic infection or an infection plus who have taken a vaccine are the ones who have the highest level of immunity. The T cells are sensitized and their B cells are also on the job. So even if the B cells wane off, the T cells will again step up and get them immune to the infection that they are exposed to. So with this, I think the take-home message, Srinidhi, that I would want to deliver is they're very safe vaccines, and they're highly efficacious as far as the data goes, and there should not be any hesitancy once they're offered. And vaccine or no vaccine, I think at the moment, unless it's a hotspot for COVID right now with the ongoing fourth wave, unless your area is a hotspot for COVID infection, please don't prevent children from going to school. Teach them masking, hand washing, and distancing, and well ventilated schools, let them go.
Thank you, Dr. Sharmila, for this amazing discussion. And parents and viewers, I hope that the message got through clear that it is essential to get your kid vaccinated against COVID-19. So do give them that gift of safety. And till we meet again, stay COVID safe. The rules remain the same, and you already know it so well. Vaccinate, wash hands, wear masks in crowded areas, and maintain social distancing, because the world is still at risk, but we have to learn to live with the COVID-19 virus and keep ourselves and our loved ones safe in all situations. Thank you and namaste.
Thank you.